Good morning, viewers. Welcome to Frankly Speaking with Vibhuti Jha. We are in the midst of amazing excitement, bewilderment, shock, name it with any adjective, but the elections in the United States produce all, arouse various sentiments of anger, frustration, looking forward to it, and all kinds of scenarios that come about. And, we know that coronavirus has stayed with us for a very long time. It has had a devastating impact on the world around us. Economies have disappeared. India has suffered so badly. America has suffered so badly. The whole world has suffered trillions of dollars of money evaporating from the markets and business. We are still in the grips of it. Many schools that were supposed to be reopening, they are not going to reopen fully. And, instability continues, uncertainty continues. Now, the second element is the presidential election. Fortunately, 3rd of November, the final ballots will be cast, votes will be cast. But there is a trick situation playing up there as well. We do not know how long that will linger on, considering the challenge of mail-in voting that has suddenly come up in this entire scenario because of coronavirus once again. So what discipline, what control will be exercised, we do not know. But the election cycle has gathered amazing momentum now, fortunately, and which is in the fitness of things. We are witnessing a pretty sensational election going to happen in America because the stand of various groups of people has hardened to whatever side you support. And the middle 7 or 8% will decide who wins the election this time, who will be in the White House. Now, to discuss both these matters plus India-related issues, I have great pleasure in welcoming back Dr. Rakesh Sharma. He's the chief of one of the critical care divisions in what hospital is this?
It's called St. Catherine's of Siena.
St. Catherine's of Siena, and
Midtown.
He's a good old friend, and he's been deeply involved with coronavirus because he was ICU in charge, expanded capacity. So, and Dr. Sharma was the first doctor he was on my program when we talked about coronavirus when it was just declared as a pandemic. So, doctor, we would like to hear from you about that. From the last time we talked to now, and the things that are happening, mask, vaccine, the number of people are falling victims of that, the real scenario. Because I was disturbed to see that one of the doctors reported that they were being pressured to give a normal death happening in a hospital, also the corona taint to that mentioned that they were also corona victims. There are certain very interesting things happening. Vice President Biden, as an election campaign, he said he trusts the science, but he doesn't trust Trump. And Trump is pushing through the vaccine. And it blew my mind away for a very simple reason, that bringing the vaccine in the marketplace is not in Trump's hand. He may relax certain rules for testing, but what cannot happen is the fact that the responsibility, the liability will remain on pharmaceutical companies. FDA will have to approve. Pharmaceutical companies will have to have the liability to do that. And as such, it is impossible to say that you don't trust Trump and people should not take vaccine. That's a very bizarre scenario. So, doctor, shoot away with your thoughts on coronavirus the way it is. Assuage the feelings of people, and tell them the exact situation the way it is happening. Because what we do know is that Pac-10 games are starting. NFL has started. NBA has conducted its tournaments in a remarkably great way. At least TV viewers are not missing the live show. Even England and Germany football games have happened in a remarkably professional way, safe way they have conducted. And that inspires hope that people come up with their ingenuity to be able to do this properly. So going forward, schools happening, not closing, not reopening in the right way. How do we see the whole thing shaping up? What hope do you give the audience and the people?
First of all, thanks Vibhuti for inviting me to your program. And I'm glad to be back again. Regarding COVID-19, I think by now your viewers know enough about COVID-19 that it all started from Wuhan, China, spread to Europe first or Italy first, and then it came to US. It has gone to India. India is one of the major nations that has seen the effect of COVID-19, but I'll be short on the incidence of COVID-19. I think what has happened is it has somehow hit Western society much more than other societies, exception being Brazil and India. But mostly, as we all know, it's in Europe, United States, and then Brazil, India, and a couple of other nations. Now, COVID-19, we know how devastating it can be to the society. It's not just the death rate or infection rate, but the harm it has done to the economy or the global economy has been devastated the entire world except China, I guess. What we are really worried about is what to do next. And I'm kind of sorry to inform your viewers that in US, in the last 5 months or 6 months, we had close to 200,000 deaths from COVID-19. If the projections are right, in the next 4 months, we will see close to another 200,000 deaths in US alone. And to me, that is very disturbing because we should have coped with it in a much better way. But I don't want to blame different agencies now. And my job should be what to tell the viewers what to do. Two things that we know very well, being in medical profession and dealing with COVID-19 from the day it started in New York. I have been running ICU, and from a very second week of March till mid-June, every hospital in New York was full with COVID-19 patients. So what we have learned now is that medications mostly do not work, and 80% people perhaps don't even need any medication. But two things that we know besides steroids that work very well, number one is masks, and number two is physical distancing. I don't want to use the word social distancing, but it's physical distance, 6 to 8 feet, and masks are ultra important. And if you cannot have N95, then you must have surgical mask, or these days we have masks made of cloth, which has a filter in the middle, and those are as good as other masks. So I would request your viewers not to take things very lightly, no matter what anyone says. I know this has been made a political fight, but it should not have been. It's not Republicans versus Democrats. Virus does not care whether you're a Republican supporter or Democratic Party supporter, and you need to save yourself and also protect others by not spreading it in case you have it. So mask is a must. If you are not home, you go outside and you are in the company of anyone, doesn't matter who that person is, please use the mask. Hand washing is okay, but mask and physical distance is something that we need to follow very closely, not only for a month or two. Now, the reason I'm saying not for a month or two is because even if we get vaccine, I just want to tell your viewers that vaccine is not going to be 90 or 100% effective, unfortunately. Will it be 50, 60, 70%? I think so. And so are we going to get vaccine on 1st of January? Absolutely not. So even if vaccine comes out in, let's say, in 2021, early 2021, most of the people are not going to get vaccine until late 21 or 22. And even if they get, it is not 90 or 100% effective. And number two, what I hear from the experts is there is going to be 2 doses of vaccine. It will take a lot more time to make 15 billion doses of vaccine. So do not just wait for the vaccine. Please make sure you have a mask on, you have physical distancing, take all the necessary precautions. If you are sick or someone in your friend circle is sick, please maintain distance.
That's a very valuable advice you have given, doctor, and without painting a dangerous scenario, but what you are saying is prevention is better than cure. The age-old saying is proving to be correct. And, so there is no battle between mask and vaccine, because you are absolutely right. There is no vaccine which immunizes you 100% about anything. Even polio vaccines or even otherwise, they don't immunize you against all strains of polio viruses. So likewise, in this particular thing also, there will be no 100% immunization. And now I think mask has become part of our life going forward. So it seems, so I was thinking about it, wearing the mask when I go out, that it's such a tortuous thing to wear a mask. And I also wonder at the same time that how people wear it as a matter of religion or a matter of routine every day, because it's such a unfortunate thing to happen. I think people will seek freedom from mask at some point in time, because it takes away your smile, it takes away your face, it takes away the recognition, your identity and everything else. But your advice is very strong and very powerful, that do not ignore the mask, do not take it lightly. The only time when you don't wear the mask is when you are all by yourself. Even in public place, you should be wearing it, because you do not know who coughed, who sneezed, who did what in the air at some point in time, whether you walked into that. That's Absolutely. What I heard. That's what I heard also once upon a time, that supposing there is nobody on the road and I'm not wearing the mask, am I safe? And the doctor answered that, what if somebody had just coughed there and gone, then you probably could be infected by that. But it's a very challenging scenario, it has. But my concern is, I'm very glad you used the word physical distancing, because I remember in our very first program, we talked about it, that we should be socially connected, physically distanced. So the word is maintaining the physically distancing is remarkably important. It's very, very important, because now we know even Canada has delayed many of its reopening of the things. And, even I read today, Thursday, I read in the papers that in North England, almost 2 million people in northeastern England states will not be allowed to meet with neighbors. Can you imagine that? These are the kind of restrictions which are coming in. And so, today, United States and India are 1 and 2 in terms of cases discovered. But tell me, you made a very interesting observation which has been bothering me for a while, and I'm glad you said that. And I wanted to ask you that question, that India is scoring high marks in terms of cases registered. But in India also, what is also very high marks for India is that incidence of death is much lower in terms of percentage-wise. Cases detection is not a failure, if I feel correct, if I say correctly. Maybe more tests are being done, and that is also resulting in more discovery. You did not do the test, you do not know what's going on, right? So what is the reason? What is the reason that in the West and Europe, this has become a very serious matter? Because WHO also reported that with 300,000 cases last week, there is a grave danger still in Europe. That's what WHO said. So what is happening? What is the reason that despite low density of population, generally speaking, in Europe compared to many other countries, why is America hit so hard with number of cases? Is it testing, or is it just because we are too open a society, or we are too liberal, we don't want to wear masks? What is the reason for that? Your thought?
I think there are multiple reasons. Number one,
Sure.
the countries that were hit first
Mhm.
had the worst outcome. The reason being, there was no experience. Doctors didn't know much about the disease process
Right.
and the
Right.
management. So, Italy, for an example, was hit
Mhm.
the first in Europe. So, they had the worst outcome. Then came Spain and England. So, when you look at the death rate, means number of people infected and the number of people who died, it was very high in Italy, Spain, and actually in Belgium did the worst. In US, although number of deaths are quite large, close to 200,000, but when you look at the population, most of the countries in Europe are 50, 60 million. US is 300 plus million. So obviously there's going to be much more or higher number. Uh, when you look at the death rate, as you pointed out, in India, although infection is the rate is quite high, but the death rate is very low. And to my understanding, it is because of two, three reasons. Number one, India had total quarantine for roughly 2 months. Number two, India was hit after Europe and United States. So they learned a lot from the mistakes that these countries made. And number three, which most of the people may not understand why death rate in India is low, is if you look at the people who actually died from COVID-19 are obese people and diabetic people, or the combination of two. Those are, I would say, about 90% patients who died were obese, diabetic, and
Mhm.
maybe hypertension in them.
Right.
So in India, obesity is not that common when you go to uh, rural areas or poverty-stricken areas.
Mhm.
Most of the people in those two groups are not obese at all. So even if when they get infection, they don't get a severe infection where the death rate would be higher. So those are the reasons why India's death rate is low.
Why is it so high in America and Europe?
Yes. Uh, when we compare US to Europe, US death rate is much lower than
Yes.
European death rate. And as I said, Europe was hit first. So they had no idea what they were dealing with. USA kind of learned a little bit from the mistakes of Europe. I know when we had cases popped up in March and many, many more in April and May, by that time we had learned from the mistakes of Europe and the
Right.
mistakes that we made in March.
Mhm.
So that's why we had a lower death rate compared to Europe. The reason why it's higher as compared to India, there's a lot more obesity in US. As you know, 2/3 of Americans are either overweight or obese. So that is the number one reason why we see so many deaths in United States. And number two is there is no central organization in United States that dictates what to do. As you understand, President of United States does not have power actually to tell all the 50 states to shut down, just like Prime Minister Modi did. In US, every state does its own job. Uh, Governor Cuomo might say that I don't care what President Trump is suggesting, I'm not going to do it. On the other hand, a Republican governor uh, in a Republican state might comply with whatever President Trump is saying. So we have 50 states with 50 different rules. And that is what has caused the problem, so much infection and no one policy. And I think United States suffered or still suffering from that mistake.
That's a very interesting point of view, and not only point of view. I think you are telling the truth. That because all 50 states have their own little policies and quirks in the whole process, because we know for sure that the 5 big states who were hit hardest in the initial stages were California, New York, New Jersey, Washington, Oregon, right?
Yep.
All these 5 states are Democratic run states who made fool of Mr. Trump's, ban on China coming. I mean, Joe Biden at that time said that he's being homophobic, and he's being xenophobic in terms of putting
Banning
a ban
the
on
flights.
China flights coming from China. On hindsight, it looks, wow, that was the smart thing to do. Even Biden agreed that it was a good thing to do. So these 5 states, which I named them, California, New York, New Jersey, Oregon, and Washington, these 5 states, Democratic states, these governors are on record. They are on record on TV many times. And I have seen that myself, saying that Mr. Trump was doing the right thing because all the help that we asked, we got. And they are on record saying that. So how ingenious is it on part of these guys, Cuomo especially, to blame Trump for not doing enough? Because these are people operating on a 2020 hindsight, which I always say that, hey, after the event is open, then every wisdom is easy to get as to what could have been done, would have been done. But these 5 states made up of 40% of US coronavirus cases and as same percentage of deaths in the country. But now Texas has caught up, Florida has caught up, but because of the varieties of reasons that you mentioned, that there is lack of awareness, no direct control. But important part is the politicization. It's inevitable because the elections are on, there will be politics. So there is a politics of mask and politics of vaccine. For you and I, that's a ridiculous argument to have as to which is more important. Both are important. When vaccine is not there, mask is your vaccine. Let's use it from that point of view. When the vaccine is not there, mask is your vaccine. Damn it, use it.
Yeah.
It's for your own life and your own safety, for your own self and your friends and family. What's so difficult about it? There is no question of freedom. So I do not agree with those people that I will not wear a mask because it's my free right. That's taking freedom too far. Just as killing in the name of freedom doesn't justify killing, right? So that's the point which is, but now we have come to another point before I switch over to the political aspect of it is, because now we are again entering flu season. The features or the elements that they are similar or same with reference to cold, flu, and coronavirus, kind of similar. However, I think I have learned that, you have constant coughing, high temperature, and your taste buds, senses decline, that you should be very careful about coronavirus part of it. Is it the time that people must take at least the flu vaccine seriously and go for it right now? At least protect yourself from one element?
Okay, as a doctor who has been in medical practice for over 30 years,
right,
I can tell you when I started practice, people didn't want to take influenza vaccine.
Right.
Then about 12, 13 years ago, there was a shortage of influenza vaccine because one of the companies that made a vaccine, there were only 2 companies, and they made some mistake, and so there was a shortage of vaccine.
Right.
As soon as media told the public that there's shortage of vaccine, everybody wanted vaccine. So, the old saying, when you want to create demand, create shortage, that's exactly how it works. But to your viewers, I am requesting, whether they miss their dinner for a week, whether they miss their paycheck, please get influenza vaccine this year. Because at least when you have influenza vaccine taken and you get sick a month or 2 months later, your 80–90% chances are that it is not flu. So you will be at least kind of protected from influenza, and you will also peace of mind. Hey, listen, I took influenza vaccine, so should I worry about COVID-19 because I have 102 fever? Uh, Everybody this year must take influenza vaccine. Best time to take influenza vaccine is in the month of October because it roughly works for 5.5 months. Don't take it too early. So if you can take in the first 2 weeks of October or third week, that would be the best time to take. And yes, to answer your question, I would request people, please take it. And government at least has been quite good for the last few years. If you have any insurance, they all cover it. Even if you don't have insurance, it's not an expensive thing. Go to CVS or any other pharmaceutical place. I think you will pay $30 out of your pocket and you will get it. Some of the places are actually giving it for free. So yes, this year, please take influenza vaccine.
Good. Thank you. That's, yeah, I think that's the
kinds of people should not take. One who has allergy to eggs. Number two, whoever tells me that they took influenza vaccine and they had such bad reaction that they were almost going to die. Otherwise, I don't care what side effect they ever had except Guillain-Barré syndrome, which is a neurological thing that rarely comes. If you ever had that, you're not allowed to take it. But please go and take influenza vaccine.
The other element which I wanted to touch about also was that the disturbing story I came to know, I read about it, that even the normal deaths in the hospitals, there were doctors who reported that they were being forced to relate it with coronavirus. Is it an isolated incident of this kind, or is it a prevalent thing? Politics of it all, because
yeah.
I'll tell you one thing, I'm so distressed with the political hyperbole that is going on in this country right now. I mean, even newspaper journalists, people who are studied economics, business, and maths, they are commenting that Trump is responsible for all the unemployment. Now, every buffoon, and I'm not insulting buffoon the animal, I love buffoons as an animal, but since it is a phrase, I'm saying that every little Johnny knows in the business that economy was doing great until the Wuhan virus hit. You know, if you want to do a cutoff period of the economy slumping around the world, whether it's India, Europe, United States, everywhere, the economies were doing well. But the Wuhan virus, I choose to call it that way, resulted in only one country benefiting, that is China as yet. It recovered the fastest because it almost looks like they knew what was going to happen. They took the preventive things, and we do not know the truth about China either in terms of information sharing. But there is a Chinese professor or a scientist who has been doing the rounds of American television channels saying, who is a whistleblower, who worked in Wuhan lab, said that this is a biological warfare perpetuated by the Chinese army, testing of the product. Because this is too well organized. And I noticed one thing very interesting again here, that nobody in the world is talking about catching the thief, catching the culprit. We are living in a world where technology, the defense technology is so strong that they can take the number plate of your car, which is perpendicular to the ground from the satellites. They can hear what we talk. You know, there is enough mechanism available to hear people talk, and we are not able to find who did it. This is something which bothers me a lot, because this is putting international political leadership on trial. Because what is happening right now is the villains, the dirty people, those who did it, are taking advantage of rule of law and the lack of evidence to declare somebody guilty. Because in this particular case, just as you could never have proven Osama bin Laden responsible for 9/11, Likewise, you can never blame Chinese Communist Party or its military or the Wuhan lab, because you say my intent was not to hurt the people. But
So,
intent is, so this is where my biggest challenge is my mind coming to the terms with is, where is the culprit?
so Mr. Jha, you raised 2 points. First one, are there doctors who are writing death certificate that patient died from COVID and in fact patient did not? I don't think so. Not a single case. Now,
Okay,
when I say not a single case, if one doctor wrote somewhere in US, I do not know, but absolutely not.
good.
It's illegal, immoral. I have been in medical practice for so long. I have worked with hundreds of doctors. I don't think any doctor will do that. So this is just a political tool that maybe other party is using,
Mm.
but there's no truth to it. Number two, raising the second point about the origin of COVID-19 virus.
Mm.
I think we all know where it came from. It has nothing to do with wet market or Chinese people eating bats. It's a cover up. Now, what really bothers me is, as you said, nobody's interested in catching the thief. All these big time politicians who don't like China, what are they afraid of? Why don't they tell the truth? This is something that I would say is beyond my imagination. If I was head of a state of a little country and even one single person had died in my kingdom, I would have been the first one to say that this was created in Wuhan lab and was leaked out, whether accidentally or on purpose, I don't know, but this has been a lab manufactured virus.
I'm very, I think in our very first program, we talked about this fact that we have to find out whether it was a simple seventh grade chemistry lab experiment gone crazy, or the genie went out of the window, or whether it was a college lab or a scientific lab or a bio lab testing something gone crazy, or it's bio warfare. I do not know, but needs to be found out. With the advancement of human intelligence and scientific and technology in discoveries, if we are not able to do that, I think people will lose faith and trust in the system, or it is just the same old story. And that's what brings me to a rather ridiculous extent to which the opposition, and in this particular case, Democrats, are going against Trump. It almost looks like, I mean, that's where Trump draws my sympathy, because the entire opposition to Trump is driven by hate. That's the problem. So when Biden says that I trust my scientific advisor, I trust by these people, but I don't trust Trump, he's raising a vague alarm, a false alarm, because Trump is not going to be releasing the drug in the marketplace. He's a president, he can only ease a rule or two to expedite or facilitate the testing or various stages of testing. But eventual liability will be FDA and the pharmaceutical companies that are manufacturing it. They are not the ones who will put through a bogus medication in the marketplace, although they will have, like the pharmaceutical industry always does, that there are hundreds of reactions, anybody can die and it may be successful or not. That's a different matter. But this politicization is, I was very disturbed when Biden said, I believe in science, I don't believe in fiction. But my dear friend, Joe Biden, you have been in politics for 50 years. That was much before I started my job in life. And I feel old now. So 50 years you have been in the government, even science has different opinions. Medicines also have the thing called second opinion, because these are all driven by scientific belief, education, and training. The politician's job is decision making. So if Dr. Sharma and Dr. Jha were to give you contrary opinion about certain scientific discovery, how will you take your decision? Politics is about decision making, not about saying that I trust science. That's obvious. Any damn fool will say that, yes, scientific evidence is required to make some things happen. But this is what politics is. And I want people to note that. Because Joe Biden has been in the government for 50 years, 8 years of which has been as a vice president. And it angers me. And I'm venting my anger at this point in time. Because when he talks about veteran affairs, he talks about soldiers dying, when he talks about the Black lives suffering, well, you have been in the Senate for 50 years. What did you do? And everything, when you say that the president is not doing right, my question to him is, what did you do for those 50 years? Your thoughts?
My thoughts are just like yours, that Vice President Biden has been around for quite some time. He has not done much. And I still remember President Trump told Vice President Biden a year ago, Joe, if you knew how to fix America, why didn't you tell that to President Obama while you were his vice president? So the answer is Vice President Biden doesn't know what to do. If he didn't do in 8 years as being vice president, I don't think he can do anything different as president in 4 years in case he gets elected. It's very easy to say the other person is doing wrong, but when you are put in the same situation, you might do the same thing. Yes, President Trump could have done a little better job with COVID-19. I'm Republican, but I have moral duty to say that. I think Dr. Fauci also did not do a good job. He was representing or still representing the medical professionals. I think Dr. Fauci has been a bad example. If I was in his place, I would have told people, if not day one, at least a week later, about the usefulness of the mask, which Dr. Fauci took 2 months to tell the public that, yes, it's good to cover the face. Yes, Monday morning quarterback, we all are right. So a lot of people will criticize President Trump for some things that went wrong with COVID-19. But the problem in this country, as I mentioned before, that 50 states have 50 different rules. There is no central body to make one rule for the entire country. That's why we suffered. And I think that's why we are going to suffer for 4 more months. Regarding the vaccine, you're absolutely right. It's not the president who approves the vaccine. It is done by FDA. So President Trump cannot sign saying, okay, let's release vaccine next month. Companies have to do their trials, phase 3. They have to give it to the public and to the volunteers. And yes, one thing I can tell you right now, because of this kind of emergency where you don't have the luxury of testing things for 2-3 years, things will not be as good as you normally expect from any new drug. If we want to bring the vaccine out in next 3-4 months, that means you only have 3-4 months to test it and to look at the side effects. Sometimes you get the side effects a year later or 6 months later. So once the vaccine comes out in the market, we may find some side effects that company did not know before launching it. And that public must understand, because you are doing it in a very fast way. This would be the fastest drug or vaccine ever manufactured and given to the public. So please don't expect that it is going to be a side effect proof. It won't be. And so that would be a very understanding kind of a message.
Now that's a very powerful point you brought about, is that even if you take the vaccine, we do not know the after effects.
Yep.
You do not know, there's not after effects, side effects most likely, most importantly. And as a result of which, we may have to live with the fear of the vaccine itself. कि मुझे क्या हो जाएगा इसके बाद, right?
It's possible.
Yeah,
It's
कहते
possible.
नहीं मोहब्बत करेगी असर धीरे धीरे. I'm just trying to make it a little lighter,
Yeah.
but you know, it is a dangerous equation actually,
Yeah, but
because
at the same time, I just want to interrupt you for a
yeah,
minute.
please do that.
At the same time, initially, I think vaccine is going to be given to those people who
Well,
will benefit more from vaccine because the disease itself is so bad. That would
correct.
be people in medical profession and elderly people living in nursing homes or someone who has a lot of comorbidities,
Right, right.
obesity, diabetes,
Mhm.
hypertension, all these things together. So these people are going to be given first. So general public still will have time to decide whether they want to take it or not.
That's good. That's very good advice. And as you know, in a famous movie called Anand, Rajesh Khanna makes a very popular statement, divine statement. Zindagi aur maut upar wale ke haath mein hai jahan pana. You know, that part
हम
of the
सब
story.
हम सब इस मंच के कठपुतलियां हैं.
कठपुतलियां हैं.
किस
तो मैं
और
उस
ऊपर वाले
बात
के
को
हाथ
नहीं
में.
बोल रहा था, but I'm going to say something else. Somebody said the same thing, and I said to him, well, in that case, don't test the proof of that statement by standing in front of a running train or a truck. Don't try to test the authenticity of that. You may live, but you will live like a cabbage in a bed. So, you know,
That's right.
there are certain times you don't test the veracity of the wisdom of the sayings that goes. But let's talk about, in the remaining time that we have, one or two key elements of the election, and that definitely engages us Indian community in this country.
Yeah.
I do know that Kamala Harris's nomination to the vice president's position created what I call a mushy feeling in the Indians. कि ओ एक देसी को बना दिया, देसी को दिया. First ever, you know, the whole Indian media went crazy. The liberal media particularly went crazy that, Indian. But then I looked at it this point of view that I respect Kamala Harris for all her successes that she has achieved, that she fought the presidential campaign to be the presidential nominee. She was district attorney general in California, the largest state in this country. Record I'm not going to talk about, which is suspect because I have not read her record. I read only in the newspapers. But the Indian point of view, that suddenly she has an Indian element, whereas she has always relied upon her Black heritage. She wants to be known as a Black woman. She has always been known as a Black woman. She has not Indian woman. And just because an Indian is a dark man doesn't make him a Black man, right? So the question is a very important one. Do we Indians need to be so mushy about her? Desi pan. That's one. Number two is that 80% or 90% of the Indians vote Democrats. Whereas in essence, 90% of Indians are essentially conservatives. Because, as I've shared with you in the past, that we take care of our family, we have family values. As a senator once told me, we love you Indians as immigrants to this country. You have family values, you are professionals, you work hard, you know, you are in the highest median income, you live a decent life, you are least problem from a law and order perspective, you take care of your children, but you don't ask for anything. And that's the important part. We Indians have never developed the ability to demand things for ourselves. This election has one element that has made me sit up. And when I say sit up, I mean that every Indian must sit up and note that the entire Biden campaign borrowed anti-India narrative from Mr. Sanders and has incorporated in Biden's campaign, so much so that Biden has been virtually running a pro-Pakistani ideology, saying things against India, an entire Democratic Party. I mean, I was so angered that I tweeted today, Thursday, that Ilhan Omar, along with 12 other Democrat Congress people, wrote a letter to the Defense Secretary not to supply weapons to India because it will be a human right violation. That must anger every single Indian about the Democratic Party's stand against India. They don't give a crap. I'm sorry to use that word. They don't give a crap about our votes. They don't give a crap because they're taken for granted They have taken for granted that Indians don't matter. Your thought?
Okay, you have raised 2, 3 points. I'll try to remember and go one by one. Number one, about Kamala Harris. Yes, her mother is from Chennai, India, but as you rightfully mentioned, she never acknowledged that after she grew up. And just recently, all of a sudden, she remembers, oh my God, my mother was actually from India, because now it's time to get votes. For years, she only identified herself as African American, actually not even black, African American, although her father is from Caribbean, but that's fine. So that to me is quite unfair, and I feel bad that if her mother raised her, because her father left the family, her mother raised her, and mother came from India, and Kamala Harris forgot about her Indian heritage for 30 years. Suddenly, in 2020, now she remembers, after she has been nominated as a running mate of Vice President Biden, oh my God, there are 1 million Indian voters in US, so I should tell them that I am half Indian. So to me, that is very unfair. Number two, when it comes to Vice President Biden and Kamala Harris, of course, I'm taking a Democratic Party agenda. They both have been anti-India for quite some time, and Miss Harris, or Mrs. Harris, whatever you want to call her, along with some of the Indians in this country who are congressmen or women, like Jay Paul and Ro Khanna, they are more anti-Indians than white politicians are. So would I vote for Kamala Harris because she stands next to all those Indian congressmen or women who are against India? Absolutely not. I think Indians who live in this country and have voting rights or citizens of this country are shifting. 30 years ago, I would say 80 to 90% Indian Americans used to vote for Democratic Party. But in the last 15 years, things have changed. It changed during George Bush's time. It also changed during President Trump's first election in 2016. A lot of Indians have switched from Democratic voters to Republican voters. I would say at this point, it is perhaps split 50-50. Will they vote more this time compared to 2016? I hope so. I don't think Kamala Harris is attracting any Indian American because of her stand towards India. So I have some of my friends who are Democrats. They will not like my statement, but I would advise all the Indian Americans to vote for Republican Party, which has been very kind to India in the last few years, whether it's a China stand, whether it's cutting funding to Pakistan, whether it's having a soft corner for another democratic country. We are the largest, we came from largest democratic country, and we are living in the second largest democratic country. So I think they need to be friends, or the best friends. So I hope that most of the Indians are not affected by Kamala Harris's mother's heritage.
I believe so too. I would hope so too, because, but then I coined a phrase, I coined a word. It's called sentimental and emotional. And I coined the word senti-emotional. We Indians get very senti-emotional about things mentioned as the Indians sometimes. But be that as it may, it has been a great conversation, Doctor. Thank you for coming over and sharing your thoughts and assuaging and educating people about how to deal with coronavirus, and very firm and clear mind and thought on the upcoming election. It's not over. There are 5 more weeks to go, and we will talk again. Look forward to having you over.
Mr. Jha, before we end, I just have one comment to make. we NRIs, or all of us who live in United States, we also stand with Kangna, because what she has done, what she has shown, she has not just made a movie about Rani Jhansi, but I think she single-handedly, as a woman, has taken on Maharashtra government, Shiv Sena, all the mafia people in Bollywood, and all these drug peddlers in Bollywood. So as NRIs, I have full support, and I hope she wins in the end.
I am very happy you said that, because these are my feelings too about Kangana Ranaut, because she has taken on a very strong mafia of the drug peddlers and the drug people and varieties of evil that besets Bollywood. Now we know about that. So thank you for bringing that up. I was running out of time. That's why I did not want to bring, but that conversation merits a full segment of its own. And we will talk about that because it has a lot of social implications. Thank you very much. Thank you, viewers. Be safe, be well, have a great weekend, and see you again next week. Thank you, Dr. Sharma.
Okay, thanks.